Good morning, good afternoon, depending on where you're calling in from today, everyone. I'm Tim Kovison with the Alliance for Strong Families and Communities, and before we get started, I'm going to quickly touch on a few process-related notes. Please note that all phone lines will be muted throughout this webinar to minimize any disruption. However, please feel free to submit questions via the chat box located on your screen at any point during the presentation. Questions will be addressed at the end of the webinar, and with that, I'd like to turn it over to the President and CEO of the Alliance, Susan Dreyfus.
Thanks, Tim. Hi, everybody. Good morning. I hope you're all having a great week. I want to welcome you all to this call and give you a few opening remarks, and then we'll go in to the content here. First of all, the Alliance for Strong Families and Communities is an over 100-year-old national association. We are the product of several mergers over that time that is now known as the Alliance for Strong Families and Communities. We have a national network of over 400 community-based human service organizations across America of all shapes, sizes, rural, urban, suburban America, and in all states. We are an organization that is focused on helping organizations to be excellent in what they do, and we do that through giving them the best in terms of knowledge, networking, and the solutions that they can use in today's environment. We also pride ourselves on being disruptive in the field and sector, taking on the tough issues, and looking at the trends and issues influencing our field and sector and getting in front of them. We are also very proud of our partnership with the American Public Human Services Association. Clearly, our two sectors are interdependent upon one another, and it's very important that we work in a deeper and lasting partnership with each other to make sure we're getting the very best results that we can in our health and human services delivery system in America and innovating together for better results. We're here today to share the findings and recommendations of a groundbreaking new study commissioned by the Alliance and the American Public Human Services Association and carried out by our partners at Oliver Wyman and Sea Change Capital Partners. This study is indeed unique and groundbreaking in both the breadth and depth of the study into the financial health of nonprofit human service community-based organizations across our country and the implications that this has for the role they play in the larger health and human services ecosystem overall and the ability for us to achieve the results we all want: improved safety, mental and physical health, improved education success, people's ability to succeed economically, and to have mobility in their economic circumstances. Our report describes the role of human services in the national economy and in society. It outlines the risks the sector is facing and makes recommendations for human services, community-based organizations, our government partners, and philanthropic partners to ensure the sector's health, sustainability, and long-term effectiveness. It is essential to note the value of partnering with Oliver Wyman for this study. As a global leader in management consulting with a presence in nearly 30 countries, Dylan Roberts and his team bring deep specialized expertise in strategy, operations, risk management, and organization transformation. Their many contributions to this report include generous in-kind support for this project, which are both notable and deeply appreciated. The development of this report and its recommendations would not have been possible without our National Advisory Council, whose members were carefully selected from nonprofit human services, government, the private sector, and academia. I wish to give them both recognition and deep appreciation as we join forces across fields and sectors to make sure our human services system truly can reach its fullest potential. The funding for this project was provided by the Kresge Foundation and the Ballmer Group, with additional support from the Health Foundation for Western and Central New York, Mutual of America, Selective Insurance Company of America, and the U.S. Chamber of Commerce. I wish to thank them for their understanding of the need for this report and the importance to move the recommendations to action. I also want to recognize the Alliance Board of Directors who have supported this important work, our board chair, Molly Greenman, who is president and CEO of the Family Partnership in Minneapolis. We hope many more people will share this report in their communities and join us in leadership to bring to life the imperative of ensuring human service community-based organizations are able to truly be at their very best as critical partners in making sure all people in America can live their lives to their fullest potential. It's now my pleasure to introduce to you a dear colleague, friend, and partner in this endeavor, Tracy Waring Evans, who is the CEO of the American Public Human Services Association, a bipartisan nonprofit membership organization representing the nation's top government human service executives. Building on the expertise and experience of the American Public Human Services Association's membership, just as we do here at the Alliance, Tracy is leading the association's efforts to drive transformation of the health and human services system to a more sustainable path that is both effective and cost efficient. Tracy has a long history in high-level policy development and public administration. Prior to joining APHSA, she served as senior advisor to Department of Homeland Security Secretary Janet Napolitano, and before that, Tracy served as the director of the Arizona Department of Economic Security, a large and integrated human service agency. It is my pleasure to introduce to you Tracy Waring Evans.
Well, thank you, Susan, and welcome everyone to this webinar. I would just like to extend my appreciation to everyone who helped put this important study together. You'll hear about it shortly and why we think it's so important for the field of human services, but also for all of our families and communities. And we're deeply appreciative of the partnership we have with the Alliance for Strong Families and Communities and the work that came through Oliver Wyman and all of our partners that supported funding this effort. At APHSA, the American Public Human Services Association, we represent public sector leaders of health and human service agencies who are working to advance the well-being of children and families so that all of our communities can thrive. Our members work at state, county, and city levels with and through the community-based organizations to provide services across the life cycle, everything from early childhood development to employment supports to supports for older adults. You'll hear us probably throughout this webinar speak to the larger human services ecosystem, and by that we mean the system under which the community-based organizations, government agencies, and the philanthropic community collectively administer and deliver these services. It's my distinct pleasure now to introduce Dylan Roberts, who is a partner in Oliver Wyman's Finance and Risk and Strategic IT and Operations practices in the Americas. Since joining the original Oliver Wyman and Company in 1989, Dylan has consulted on a wide range of strategy, organizational design, and risk management issues with universal banks, investment banks, and insurers in North America, Europe, and Asia. His area of focus is finance and risk organizational design, governance, and compliance. And I can tell you that having access to his expertise and that of his team and his experience through this national imperative work has been absolutely invaluable to us. So with that, I'm going to turn it over to Dylan to share the findings and recommendations from the report. Please note that we'll have an opportunity for questions at the end of the presentation. Dylan?
Thank you very much, Tracy, and thank you also to all the attendees of today's call. It really has been an honor and a pleasure for Oliver Wyman to work on this study, and we really appreciate having the opportunity to talk to you about it today, and we appreciate your interest in learning more about our findings and recommendations. I want to start by giving you a sense of what we actually did. We worked for about 9 months on the study from last spring through December, and we crunched a ton of financial information about human services CBOs. We downloaded over 200,000 tax filings, 990 tax filings, which covered multiple years associated with 45,000 unique CBOs. So that's a very robust and comprehensive data set that we were working with for financial information. We also surveyed and spoke with over 200 leaders in the human services ecosystem, defined broadly, as Tracy described. So that included both executive directors and board members of CBOs, as well as heads of public agencies, individuals within philanthropic organizations, academics, and so on. So it was a broad group of participants with a very diverse set of perspectives. And before we get into the findings and describing the themes of the study to you, we wanted to acknowledge that a lot of the themes and recommendations will be familiar to those of you who have been involved in human services for years. We did find that many of the issues that we described, while familiar, are still present and important, and in some ways are getting worse. And so we wanted to recover those issues in as much depth as possible. That said, if you want to focus on what's new about this study, I would again highlight two of the points I just made in describing our work effort. And those are, first, that the financial analysis we did for this study was very deep and comprehensive. There are a ton of opinions and perspectives about CBO's financial status out there, but the observations in this report are supported by a very deep fact base as well. And secondly, I wanted to highlight again the fact that this study brought together lots of different groups, including those who often have opposing views of the issues facing human services CBOs. And we wanted to acknowledge that it's easy, and it happens, that CBOs get together and talk about all the things that government should do differently. And on the flip side, government agencies get together and talk among themselves about all the things that CBOs ought to do differently. And those discussions are maybe cathartic, but in some cases they're really not that productive, because we really do think that solutions are going to require a shared view of success and consensus on what needs to change across all of those organizations and kinds of organizations. And we think one of the credits to everyone involved in this study is that everyone involved worked hard to bridge those divides and to work together to think about solutions and required changes on both sides, both CBOs and government agencies and elsewhere. And we think that might not be completely unique, but it is a little unusual and distinctive, and it's ultimately been very valuable and will be very valuable to achieving the desired outcomes going forward. So with that context, I will flip forward, and we wanted to take a moment to set context and really highlight on this slide how large, complex, and important human services CBOs are. So this chart gives you an overview of how CBOs are funded. It shows you the major players involved in the funding and also how the financials flow. In the thick print report that we produced as part of this study, there's more detail starting around page 19 on this chart, but we wanted to call out a couple things in this webinar. First is at the center of the graphic, in the darker blue circle, we have the human services CBOs themselves. There are 218,000 of them by our count, and that's a huge number, which we think is noteworthy in and of itself. We also wanted to, in focusing on that number of 218,000, we wanted to emphasize how tremendous the spread is within that 218,000 in terms of size and complexity of organizations. Public opinion often thinks about CBOs as small volunteer-driven organizations, as charities, and there are a lot of those. 80% of human services CBOs have annual budgets less than $500,000. But it's worth noting that the largest 3% of those CBOs, so roughly a little over 6,000 organizations, account for 50% of the sector's total service provision. And these are organizations with budgets in excess of $10 million. So they're very large, they're complex operating organizations, and we think it's really important to acknowledge that fact and to note that a simplistic view of CBOs as small volunteer organizations really understates the complexity and size of at least a small number of large CBOs. We also think that view of CBOs as charities and volunteer organizations reinforces misbeliefs and misperceptions about CBOs' funding. Namely, there's a common view among members of the general public that CBOs are mostly funded by donations, and they're not. As this chart shows, roughly 3/4 of their funding comes in the form of contractual revenue, which is earned by providing services on behalf of public agencies, and it's actually paid as revenue from those agencies to the CBOs. So in effect, CBOs are large and important government contractors. And as the chart shows, the government entities spend up to $150 billion on services that the human services provide. And if you add in additional sources of funding for the CBOs, like philanthropic funding and investment income and the like, the total amount of funding that they are spending to provide services, so the value of those services that are being provided out, is more like $200 billion. So that's obviously a big number. How can we think about that? How important is that activity to our economy? And we wanted to give you a couple of reference points to contextualize that. $200 billion is about the same as the annual revenue of the U.S. airline industry. It's about a third larger than the revenues for the entire accounting and tax prep sector. So we all have intuitive beliefs and understanding that those are big industries, big and important industries, and we're talking about a number that is the same size or larger. So it's a very important driver of economic activity. It's also worth reflecting on what happens to that $200 billion that gets spent by the CBOs. A lot of it gets paid out in salaries to their employees, to counselors, to social workers, and the like. A lot of it also gets spent as rent, gets paid out to landlords, as payments for supplies, and so forth. So that money flows out into the communities that the CBOs operate in. It then gets respent on other things, and so there's a multiplier effect. And it really is a very important stream of economic activity and driver of additional economic activity in those communities. We don't want to overemphasize size, though, as the only measure of importance. So let's also spend a little time discussing how important these services are to the individuals and communities that receive them. And on the right-hand side of the page, we've noted that these services flow out to individuals, families, and communities as a whole. And there's some amazing statistics associated with who benefits from these services. Overall, about 1 in 5 Americans receive critical human services from CBOs each year. And to give you some specific numbers, 47 million Americans, huge number, rely on food banks. If you look at the foster care system, about 750,000 children pass through that system each year. So 750,000 is obviously a lot less than 47 million, but when you think of how incredibly important that system is to those kids and what a huge impact it has on their future lives and their future productivity, it's a big, big deal. Another interesting statistic, roughly 3 million Americans are receiving mental health treatments from CBOs at any point in time. And those are obviously just kind of specific data points. There are lots and lots of data points associated with all the different kinds of services that human services CBOs provide, and we just want to make the point that they touch a huge number of Americans, and they are very critical to the well-being of those Americans. Which brings us to the next point that we want to cover, which is what are CBOs' impact on economy and on our economy and on society more broadly. And we want to put a stake in the ground to argue that there's an opportunity for CBOs to have an even greater and more transformational impact above and beyond what we've just described. So the points on this slide are covered in greater depth beginning in page 24 of the written report, but a couple points we wanted to make here. First is that in the future, human services CBOs are likely to have a much greater impact simply because the demands being placed on them are going up. Demand is growing quite strongly. And if you think about things like the opioid crisis, income inequality, and frankly just the aging of America, all of those things are driving increased need for human services. Some, like the opioid crisis, hopefully will be turned around and addressed. Others, like the aging of America, are going to happen for a while, no matter what anybody does. And so there will be growing need and demand for CBO's services. So what happens if those those growing needs are in fact met effectively? On the right-hand side of the page, we've said it will really position communities to meet their full potential. And what we mean by that is communities that will be healthier, and they'll also be more productive. Their citizens are going to be more likely to be employed, more employable, and more likely to be working productively. And so what happens when you have communities that are healthier and also more productive? You really create an incredibly exciting virtuous cycle. Healthy communities are going to need less healthcare interventions. Obviously, their populations are going to still need health care and they're going to need preventative care, but they're less likely to require, for instance, expensive emergency hospitalizations. And when they're productively employed, they're also less likely to exhibit behaviors that are potentially going to lead to legal problems and drive spending in the judicial and correction systems. So the argument that we're making is that correctly done, investment in human services CBOs offers society a way of addressing two very expensive problems which have proved very challenging to address. One is healthcare spending. We spend more money than any other developed nation on healthcare today, but we have worse health outcomes. And the second is spending on the correction system. We spend astronomical sums as a society on corrections, in part because relative to other countries, a greater portion of our population is incarcerated. And that's what we really see as the potential for human services CBOs, to break those cycles, to make communities healthier and more productive over time, and in doing so, to allow us to address these big pools of spending for healthcare and corrections that really are a drag on the economy today. And we just wanted to underscore on this next page again the nature of the relationship between human services and healthcare. And the chart that's shown here is drawn from a study conducted by the University of Wisconsin Population Health Institute. And they looked at what drives health outcomes at a population level. So if you have two small cities and you compare them and the population in one is healthier than in the other, what are the underlying factors that have driven that outcome, that one population has better health than the other? And it's fascinating because one thing they found is that actual health care, so ability to access health care and the quality of that health care, only determines about 20% of the health outcome for a population, which was not intuitive, to me at least. The other 80% of factors that drive health outcomes, as shown on this chart, are things like socioeconomic factors, things like community safety, family and social support, education, health behaviors, so do people choose to use tobacco, do they engage in risky sexual health activities, do they abuse alcohol, and so on. And 10% is associated with the physical environment, so do they have safe housing, is the community infrastructure well maintained, and so forth. So you add that up, 80% of factors are actually things that are addressed by human services as opposed to by the healthcare system. And not surprisingly, we spoke with the chief medical officer of a large hospital in a very low-income area as part of this study, and he made exactly this point. He says he's trying to figure out how the hospital can improve the health of the population in the area that it exists within, but he feels like he's fighting a battle with one hand tied behind his back because by the time people get to the hospital, they can only impact that 20% of the health outcome that's associated with quality and access to care. 80% of what determines this person's health is stuff that's already happened, associated with, again, their employment, their tobacco use, the safety of their housing, and so forth. So it's a huge, huge connection between human services and health. And we see that internationally. If you look at OECD countries, they actually spend more on human services than they do on health care, and they get better health outcomes than the United States does. In the United States, it's the opposite. We spend significantly more on health care than we do on human services, and we spend more on health care than do other developed nations, but we end up with worse outcomes. And the argument is, in part, that's because of underinvestment in human services. And international comparisons are interesting, but obviously different countries are different for lots of different reasons. But the text at the bottom of this page also gives you some interesting findings from a study that was done domestically, just looking at the U.S. So a researcher at the Yale School of Public Health looked at U.S. states and looked at the relationship between how much is spent on human social spending, so human services related spending, relative to health spending within those states. And the finding was that those states in which there was more spending on human services had better health outcomes 2 years down the road. And those better health outcomes, are then associated with reduced need for expensive health care. So there's a direct flow through to the cost of health care. So very, very powerful relationships between human services and healthcare outcomes and healthcare spending. So that's great. We think it makes a very powerful argument for the potential of CBOs, but are CBOs really positioned to deliver on this potential? And unfortunately, the answer is that today they're not. They face some serious constraints on their effectiveness. In our written report, there's lots of detail on these factors beginning on page 31, but we wanted to highlight in particular some financial stresses. More than 10% of CBOs are actually technically insolvent. Their liabilities exceed their assets. And a really staggering figure for us, 30% have financial reserves that are equivalent to 1 month of expenses or less. And we looked at this across geographies, and we found it afflicted, those statistics were similar across geographies. We looked at it across sizes of CBOs, and we found that there were many severely stressed CBOs at both large and small, among both large and small CBOs. It really is a common finding across any population of CBOs. And when you think about an organization operating with less than 1 month of expenses in the bank, it means they're skating on very thin ice. So any unexpected financial event, their roof starts to leak and needs to be repaired, or a contract that they think they're going to win falls through and doesn't come through, it immediately places these CBOs in severe financial crisis because they've got payroll coming up in 2 weeks, 3 weeks, 4 weeks, and very possibly are going to struggle to meet that. That also means that those institutions have very limited capacity to think about building their own organizational capacity over time. You ask yourself, are they able to think about how to scale their business optimally? Are they able to plot a strategy for investing in IT infrastructure that will allow them to run their businesses efficiently over time? Are they able to think about innovating and developing innovative new service packages? Absolutely not. They're going to be focused on that next payroll, and they're not going to have either time or money to devote to longer-term strategic issues like that. And that's a real constraint on their long-term effectiveness, their long-term ability to realize the really incredible potential that we just described. So why do all these conditions exist at CBOs? There are lots of reasons, frankly, but a couple that we want to highlight. In the case of financial stress, certainly there are some practices within CBOs that we think contribute to financial stress. Many CBOs have not been able to invest in robust financial reporting systems or in risk management capabilities, and as a result, they don't actually have the tools to know if they're approaching a financial crisis or able to manage it when it does occur. We've also observed in many institutions a lack of commitment or insufficient commitment to building financial reserves and management infrastructure. And that sounds like a harsh criticism, but it's completely understandable. CBOs are mission-driven, by and large, and their missions are incredibly important. And in many cases, they face greater demand for services than they can meet today. And obviously, every dollar that they divert to build up their financial reserves is a dollar not spent providing services to clients who need them. And these clients really need them. So that's a very, very difficult choice, and many CBOs, in our observation, continue to prioritize mission as a result. But we do think it's absolutely critical that they balance that decision and also build long-term sustainability and stability. We also want to highlight, as a cause of financial stress, constraints that are imposed by contracting and grant practices, both on the part of government agencies and philanthropy. In particular, government contracts for human services are not typically what you would call cost-plus contracts. So a cost-plus contract is one where payment for a service equals the amount of money that it's going to require the provider of the service to spend, plus some margin. And in the case of government contracts for human services, they're really cost minus, meaning that the government agencies reimburse CBOs something less than the full cost of the services they provide. And CBOs are then expected to find charitable donations or other sources of funding to make up the difference. So government agencies buy services at a deep discount. As a matter of course, CBOs are left figuring out how to deal with that gap, and that really contributes a lot to the financial instability that we're discussing here. And it's a unique feature to how government agencies deal with CBOs. They are not imposing similar contract constraints on their contracts with commercial vendors, commercial for-profit vendors. And so we think that's very important to note. Moving on to operational shortcomings, we think there are a couple of things worth noting here. First is that the human services ecosystem tends to operate within pretty strong organizational silos, and those silos in many cases prevent government agencies and CBOs from sharing data with each other or from collaborating on important things like population needs assessments. It prevents CBOs from collaborating with each other to develop integrated packages of services to serve interdependent needs that exist within a population. And really we want to flag again the importance of data sharing, because a lot of the data associated with human services provision is very private in nature. It includes healthcare data that has regulatory constraints on its privacy, but it's really important that data be shared at some level so that outcomes can be tracked across CBOs and across time as service recipients age, move around the country, and pull down services from different providers. The third column that we wanted to highlight here as a driver or as a roadblock to realizing the full potential for CBOs is mistaken beliefs. And we've highlighted a couple of these in the discussion so far. Again, we tend to think of, or the public at least tends to think of CBOs as charities as opposed to complex operating organizations. It's also worth noting that government agencies in many cases tend to think of CBOs in a transactional manner as service providers. So a homeless shelter is viewed as a provider of a certain number of beds or a certain quantum of bed capacity. And that tends to impose a short-term view of their function. We really think that CBOs and agencies should develop a more strategic partnership-based approach in which they're really focused on how can this homeless shelter be viewed as a long-term solution to clients' housing needs, how can the government agency and the homeless shelter cooperate together to try to map out a transition to stable permanent housing for their clients, as opposed to just getting a night off the streets. But we don't think that model is quite there yet. I would also highlight again a lack of trust in some cases of human services stakeholders. Many government agency contracts with CBOs include very strict constraints and rules about how the funding can be spent, what portion needs to be spent on direct service provision, what can or cannot be spent on organizational capacity building, and so forth. And in our view, that really betrays a lack of trust of the CBOs themselves. Large CBOs, if they're well run, and if you believe they're well run, then we would argue that when you contract with them, you should trust them to make appropriate decisions about how to balance program spending versus organizational capacity building and the like. But that trust isn't quite there yet in many of the contracting arrangements that we've observed. And then lastly, in the fourth column, we wanted to note both talent and technology limitations that CBOs suffer from. The technology limitations are a direct outgrowth of the financial stresses and contracting processes that we've described previously. Many CBOs have just not been able to invest in robust IT and reporting infrastructures. They've also not been able to invest in things like technology-enabled remote delivery processes. And those constraints also kind of carry over to the human capital market and have impacted CBO's ability to pay for and therefore attract and retain talent who they compete with for-profit providers for in many cases. So it's a tough situation, we would say, that CBOs face with a lot of constraints on their ability to realize their full potential. And if we flip to the next page, we wanted to highlight what we view as 5, we're calling them Northstar Initiatives, and these are 5 really important imperatives that we are putting forward and recommending should be embraced by both CBOs and their partners in the human services ecosystem, both government agencies and philanthropists, in order to steer the CBO community towards a future in which it's better able to realize its full transformative potential. And those 5 North Stars are first, reiterating and deepening a commitment to outcomes. We believe that both agencies and CBOs themselves should be committed to allocating funding to programs that have proven positive outcomes over time, and that's going to require a lot of investment in data gathering, data management, data storage, as well as analytics to track those outcomes over time. It's also going to require a shift in operating procedures so that that information and that data can be shared across geographies, across programs, and across organizational silos. So people talk a lot about commitments. People are starting to measure them more, but we think there's a long way to go before there's really a widely held standard view of how to think about outcomes and how to measure them over time, and it won't be easy to get there. So that's North Star number 1. North Star number 2 is a commitment to developing capacity for innovation. And this is in some tension with the North Star number 1, a commitment to outcomes. We think that it's important to commit to investing in programs that have proven outcomes, but we also do think it's also important to commit to reserving a share of funding and a share of activity to invest in experimentation. Innovation is not something that's easy. It's not something that's easy to predict. And we think CBOs and government agencies should be experimenting, should be coming up with new delivery processes, new service packages, and the like. And many of those experiments will fail. And it's important for everyone to acknowledge that up front, that if you're trying to innovate, there's a high failure rate, and that's how you learn, and that's how you identify that subset of innovations that are positive and have good outcomes, and then you can double down on those. And so we think that's a cultural change and a funding change that, as we've said here, CBOs need to be allowed to fail forward, meaning try 10 things. 9 of them might fail, but if you identify a fantastic innovation with that 10th experiment, that's great, and then you can double down on that and go forward on that basis. Third North Star is something we're calling Operating Model 2.0, which transitioning to a more strategic partnership approach. And this has a couple of components to it. First, as noted here, we think CBOs and public agencies should be partnering together to develop solutions and to think about solutions for the populations that they serve. So CBOs shouldn't be interacting with government agencies just when they get an RFP that says, hey, we need this many beds of homeless shelter capacity for the next quarter, please submit your bids. CBOs and government agencies should be interacting with each other way before that and sitting down together to understand the dimensions of, in that example, a homelessness problem in a given population and to think about different solutions for that over time. We also think that this implies, again, transitioning to a more partnership-based rather than a transactional procurement process. It's obviously important and fair for government agencies to consider cost of services in their procurement processes, but we think that a purely transactional procurement process that just goes out and procures services on a lowest cost bid basis really misses the point and misses the opportunity to think about developing strategic partnerships between CBOs and agencies over time. Fourth, Northstar Initiative is implementation of improved financial management policies and practices. This comes back to the point we were making earlier, that many CBOs have not yet been able to invest in strong finance and financial risk management capabilities. And we think it's important that they do so, even if that means making a hard choice about investing in long-term development of systems versus today investing in additional program capacity. We also think there's an important point here to be made about the public agencies and how they can make a change in order to improve financial situation and practices at CBOs. And that is, in short, to reform their contracting processes to make sure that they provide full and timely payment to the CBOs. So cost-minus contracts are never going to create a strong foundation for CBOs to be stable over time. We also have heard a lot of observations that the payment cycle associated with some public contracts is extremely long and lengthening, and that also creates a tremendous amount of cash flow pressure and uncertainty for CBOs, and we think that needs to be addressed, again, if they are to become stable, sustainable organizations who are able to reach their full potential over time. And then the last of the 5 North Stars we're calling regulatory modernization. CBOs face a very complex web of regulations which exist at the federal, state, and local level. In many cases, those regulations are outdated or duplicate each other or frankly, just seem to impose a burden on the CBOs that isn't actually productive or doesn't relate well to the stated goal of the regulation. And as a consequence, CBOs spend a ton of their person hours on dealing with regulatory compliance rather than all the other important things they could be dealing with, like service delivery or organizational capacity building over time. So obviously, regulation is important and it can be good, but we think that the CBOs and the public agencies at different levels, again, federal, state, and local, should sit down together to examine the full web of regulation that currently impacts CBOs and to try to come to a joint view of where there are opportunities to either eliminate or simplify and streamline regulation. We think that could have a huge impact in terms of addressing the financial stress that CBOs face today. So those are the 5 North Star initiatives that are described in further detail in our report. And a lot of people who we've described those North Star initiatives to have said, yeah, that's great, but that's really ambitious. People have known about these problems for many years, and we've even talked about some of these solutions for many years. How the heck are we actually going to make this happen? and what, if these problems were going to get fixed, why do they still exist today? And we acknowledge that it's a challenge, but we also wanted to highlight on this last page the fact that these ideas are already working. They're already being implemented in pockets around the country. And we think that's really important. This study, at the end of the day, probably didn't identify too many things that are blindingly new. Many of these ideas, again, are familiar, but these ideas haven't yet realized their full potential. And so we think the challenge for CBOs and for government agencies together is to just pick up on these points of success where these ideas are already being implemented and figure out how to scale them, how to replicate them, so that 5 years down the road, rather than pointing to pockets of success, we can point to an entire transformation of the sector, and as a result, a transformation of the impact that the sector is having. And so just quickly to note a couple of the case studies that are highlighted on this page. Dakota County, Minnesota has made a tremendous amount of progress transitioning to more performance-based CBO contracts. They're building target outcomes into their budgeting and fund allocation process. CBOs are obviously lining up with that as well in order to win those contracts. And we think that the whole business system, in effect, within that county has made a tremendous strides towards becoming more outcome-oriented. If you think about innovation, we wanted to highlight Blue Meridian Partners, which is a fund which is making big, long-term bets on innovation. And we think it's really important. They are identifying programs that they think have the potential to have a transformative impact on the sector. And they're making these bets to help those organizations build capacity and scale. So they're not putting $200 million behind just service delivery. They're really saying, how do we take this organization and scale it, replicate it, make it bigger, make it so that it will be 10 times larger 5 years down the road and having 10 times the impact. And we think that's incredibly important. Third, if we think about different and more cooperative operating models, we wanted to highlight the Children's Home Society of Florida and Florida's Community Partnership Schools. Students in those schools are receiving integrated support packages. So they're getting services not from one CBO here and another CBO there, but rather they're getting a comprehensive package of services that have been designed as a comprehensive whole to meet their needs. And these programs and packages include health and wellness support, nutrition support, after-school programs, counseling, and so forth. And this is a huge partnership effort. It involves CBOs, it involves government agencies, it involves the school district, it involves health centers, and so forth. And we think that's a very powerful model for the future as well. Fourth, when we think about contracting and financial arrangements, we wanted to give a shout out to Montgomery County, Maryland, where they have revolutionized the way they calculate reimbursement rates and, importantly, how they cover indirect costs for CBOs. So they're kind of transitioning away from that cost-minus contracting model, very important. And then lastly, in terms of regulatory modernization, we wanted to highlight the experience of the Colorado Department of Human Services, where they launched a regulatory modernization program a few years back and managed to knock out 20% of state-level regulations targeted at CBOs. They also made some operating changes going forward so that CBOs are now more formally involved in the development process and evaluation process whenever there are changes considered to regulations or whenever they're thinking about introducing new regulations. So that's a much more productive and rational approach to regulation in our minds, and it's having some good outcomes. So again, we wanted to highlight these examples because we know it's easy to tear out your hair in frustration when you think about the enormity of the challenge sometimes, and when you think about the degree of change that's implied by the Northstar initiatives that we described. But we're really inspired by examples like these highlighted on page 13, and others that are covered in our written report, that to us show that the biggest impediment at the end of the day to creating the change and driving the change that we've described, it really is collective will to act. This can work, it can happen, and we really just need to make it happen now. So that concludes our formal remarks. I'm going to pass it back to Tracy, and she can share some thoughts on what's next and also how you guys can help and get involved.
Great. Thank you so much, Dylan. Thanks for that very thorough look at the recommendations and, importantly, those kind of Northstar initiatives. So just briefly, before we open it up for questions, I wanted to highlight to Dylan's point about what's the collective will here. So what's next, and how can all of us help move these recommendations forward? With the formal release of the report last week, we began our dissemination phase, and we've been asking our members and partners and media and colleagues to share the report with their respective networks and communities as far and wide as possible. And we've seen just a tremendous response to that request. We've been featured in more than a dozen news articles. The report and the study have been shared widely among organizations across both the Alliance Network and APHSA and many of our organizations that we work closely with. Colleagues such as Dan Cardinelli, who leads Independent Sector, and many of you may know, published a Q&A with Susan and myself, and this week we'll be speaking on the report at the Lutheran Services of America's CEO Academy. There are many other instances. I won't go into details on those about how it's being shared, but we just want to really show appreciation for folks who have helped disseminate the important study here and build the momentum so that we can create as much awareness first and then really move into that action phase of how we take these recommendations and create better opportunities to make sure that we're leveraging all that comes with the community-based human-serving organizations across the nation, and how we can lean into that through the public sector, through philanthropic support, and with many other partners in business and otherwise. The Alliance is going to be featuring the report at its Senior Leadership Conference in just a few weeks and at their national conference in the fall, both of which will be great opportunities for folks to hear more information and participate in conversations. At APHSA, we will highlight the report at our upcoming annual summit, which is in Arlington, Virginia in the first part of May 6th through 9th. So if you're participating there, look for opportunities to learn more and lean into the report. And then we're really trying to take this kind of opening up phase and get in front of key audiences and decision makers and influencers so we can begin to identify and capitalize on opportunities to collaborate and really move into the action phase. And so if any of you who are participating on the webinar today would like us to be part of any engagements that you're interested in sharing information about or getting involved actively in any aspect of this, please don't hesitate to reach out to Susan or myself or any of our team members. We'd love to be part of those conversations. So just one other thought, and then I'll turn it over to Rahana to walk us through some Q&A. But Susan and I, obviously believe very much in our respective networks that we need to align the findings and recommendations from this study to our own respective offerings. So one way we just highlighted is how we'll bring this forward in our annual events. But we're moving quickly in partnership with some other organizations, including, for example, Social Finance, an organization dedicated to mobilizing capital to drive social progress, in having conversations about actually developing a national laboratory for contracting and procurement reform, an area that you just heard from Dylan is really ripe for modernization and action. And so more to come, we hope, on that front as we look to secure funds and move that idea forward. I hope you can tell that we're really excited about the opportunities here, understanding that there's some lower hanging fruit here, and then there's some bigger initiatives that we really have to lean in and find the collective will to move forward. And I'd just like to thank everyone for taking the time to participate with us, and that will conclude our formal remarks, and I'll turn it over to Rihanna for any questions we may have.
Thanks, Tracy. So we're going to go ahead and open this presentation up to questions. To ask a question, please submit your question through the chat box that's located on your screen. To get us started, we have a question from Jed Dews, and he's asking, these investments in capacity, infrastructure, and innovation are wonderful, but the general public still believes in the overhead myth. Charitable donations are often contingent on low expenses in the proposed areas. Any thoughts on shifting public opinion on nonprofits who invest in these areas?
Susan, you want to take that one, or?
Sure, happy to. And Dylan, you might want to add to this too. You asked any thoughts on shifting public opinion on nonprofits who invest in these areas. When we had our summit, we held a summit in December on an embargoed copy of the report. One of the things that was interesting when we had this broad cross-sectorial group come together to look at the report before it was finalized was that everybody commented that the 5 North Stars are all very important, but the one that will supersede all of them and could accelerate all of them is the commitment to outcomes. I truly believe that if we can come together across sector and clearly identify what the outcomes are that we are striving to achieve with clearer measurement, and we could start to find ourselves together focused in that way, I think some of these myths will start to change. But one of the things that was really clear with that cross-sectorial group that got together in December is that we continue to have a lot of inconsistency in what we view the outcomes to be, what we think the measurement of those outcomes are. And I think that when we can find that together, which is why our partnership across sectors is so important in this work, that to me is what's different than what has happened in initiatives before, is I think if we get clear on those outcomes, and that's where our focus is, and that's what we're demonstrating, I think some of this other myth will begin to go away. But it's a good question, and it's a tough issue.
Yeah, I think it's a great question, and I would just highlight that marketing and PR is another capacity that private sector organizations and businesses spend a lot of money on. And in the cases of CBOs, our sense is money is spent on services, service provision, and mission. And there really is a need to invest in getting the word out and addressing some of the myths and correcting some of the misperceptions that we've been talking about. So I think you're absolutely right. It's really important to engage with public opinion explicitly. We can't just, we can't wait for public opinion to fix itself. I think the sector has to play an active role in addressing that.
Great, thank you. Next question from Uma is, our jurisdictions have midterm elections coming up, and this report and toolkit could be invaluable in helping our CBO sector develop a transition document. Will you be able to come, if invited, to speak to the audiences locally?
Yeah, between Oliver Wyman and Sea Change, we will figure out a way to support you guys.
Yeah, and from the Alliance and APHSA, we welcome from any jurisdictions opportunities to engage with you, and we'll do our very best with the understanding that there's a lot of communities across the nation to support you in any way we can.
Thank you. Another question from Dan Magnuson. As with any business growth or change agenda, investment of financial resources is necessary to address especially the transition period from now to the next level. Given that nearly half of most CBOs have less than 1 month of resources, what are some key first steps to advance to that next level?
Dylan, you want me to take that?
Sure.
Okay. Thanks, Dan, for that question. So, there's no one answer to, again, that very deep and important question. One of the things I want to just reiterate that Dylan referenced in one of the slides is that given that nearly half of most CBOs have less than 1 month of resources, that finding did not vary greatly by organizational budget size. It varied somewhat, but I think that was a surprise to us, that this issue is not just for the smallest of organizations. I personally know of organizations in our network with $100 million in revenues flowing through their budget every year who operate on less than 30 days of cash. So I think one of the things, though, that we are going to have to start to think about is in order to have the capacities that we need, we've got to be moving. That's why we have 5 Northstars. We have to be moving on all 5 of them in a concurrent way. They're not sequential. But I do think something that the sector does need to start thinking about is how we're going to leverage one another more fully. If that is in merger, if that is in deep affiliation, if that is getting more intentional about creating back office utilities, something the Alliance would like to be leading on coming out of this report is helping more back office utilities to get established across the country and be connected to one another. But I also think it comes to our boards of directors. That was something, too, that was a big insight for me from the work Oliver Wyman did, was the importance of board of directors being very intentional and diligent in their financial management of their organizations and building the financial capacities of their organizations. So I know that's kind of a roundabout way of answering your question. There's no one answer to it, but we think it's imperative that we find together the multiple solutions that are going to give the sector the financial capacities it needs to have the capacities that it needs to achieve on outcomes.
Yeah, I guess I would just flag again that building financial reserves, it's kind of like any other savings plan. The organization just has to commit to it and chip away at it, and you don't get there in 1 year or 2 years or 3 years necessarily, depending on how big a hole you're facing, but you've got to kind of start to sock away pennies and dollars when you can and make it a long-term journey to build those reserves. And the other point that I would make, and something that is helpful in accelerating that journey, is we think CBOs do need to become braver and more selective about what contracts they accept and what contracts they say no to. Because every transaction has 2 people on there are 2 participants in it, a service provider and a service acquirer, and if CBOs are agreeing to contract terms that are punitive and really hurt them over time, well, they should stop. And I know, again, that's easy to say and hard to do, and it's easier for organizations that have multiple service lines across multiple geographies and therefore have some level of diversification than it is for monolines to do. But this is another thing where when we went out and we spoke to the CBO community and we talked about the idea of saying no, if we had 10 organizations sitting around a table, sometimes it felt like the first 9 would shake their heads and say, yeah, we can't do that, we can't do that. But eventually we'd find one that said, oh, actually we did that. And, to our surprise, it's worked out okay. It hasn't been easy. We have lost some relationships or some contracts, but we've also migrated to a world in which the people who we are continuing to do business with seem to understand and respect our economic needs. So, again, I don't mean to be overly simplistic in suggesting that. I know it won't work in every case and it won't be easy, but we do think that's part of the answer over time.
This is Susan. We actually have members in our network who do not accept contracts that are not fully funded. And I think, again, every organization is different, but we do have organizations where that is their policy, but it's also because they have a critical understanding of what it costs them to deliver on the outcomes that are being asked of them. And that's another case in point and something that the Alliance will want to be working to help our Strategic Action Network to make sure it has the capacities to truly understand what it costs them to deliver services and what is required for those services to be fully funded.
Great, thank you. Pam Darnell has asked, will we get the PowerPoint to share with our boards? Great question. In fact, earlier today, you should have all received a link to the report as well as a link to the toolkit, both of which can be found on alliance1.org. In the toolkit, you will find social media posts, template press materials, presentation materials, and background talking points. And we encourage you to use those to share this information with your media colleagues and networks. So again, if you by chance missed the email, they also can be found on alliance1.org.
And then Pam, just let us know if you think it would be good for us to hold a couple of webinars that are for board members who could dial into it. Maybe not, they won't be at a meeting, maybe they'll be, at their homes or at their place of businesses. But if you think that might be helpful to the whole network for us just to hold a couple of webinars for board members, please email us and let us know.
We also have a question from Rebecca Shadeen. The speaker is making a great point about articulating shared outcomes. However, agreeing on universal outcomes and measurement and all of the related ingredients have historically proven challenging and had mixed results. How do you propose to identify and advance universal outcomes and tackle this issue?
This is Susan. I absolutely agree with you on how challenging it is. Like many of you on this call, we've been at this work for a very long time. I would tell you that I think we are the closest I've ever seen us to have the ability to be in coming together across sectors with government, with our sector, with philanthropy, with academia, and that's through the lens of the social determinants of health. They're indisputable, they're very clear, they're very measurable, they can be data mapped at a geographic level, and so I get excited when I think about, that's why I love that Oliver Wyman on their own got a hold of this larger ecosystem and saw its potential to drive larger population-level health results in our country, with health being broadly defined. I think the way we could do that is through the dissection of the social determinants of health. And then what we're going to have to do is decide what are the real core drivers to safety and security, economic mobility, population health and well-being, and education success, and then decide which measures that we should be grabbing hold of in each one of those. It's something the Alliance is working on right now with our network through our theory of change.
Thank you. A question from Nancy Balderica. Aside from outcomes, what do you recommend as other ways to change the perception that CBOs are quote-unquote charities?
Dylan, you want to take that?
Sure. I think, again, to me, that's really a marketing and PR issue that I think public opinion is somewhat shaped by the number of CBOs. So coming back again to the notion there are 218,000 human services CBOs, a huge proportion of those, many tens of thousands of organizations, are small, volunteer-based, charitable organizations that, and I think by sheer number, those are the ones that tend to shape public opinion. But again, 50% of the sector's total services are being provided by organizations that are big, complex, really businesses, in everything but their tax definition. And it's just not intuitive to many people who aren't directly involved in the sector to understand that. And it's never going to be intuitive, so the sector has to kind of reach out and tell the world. So to me, it's really an outreach and marketing challenge for the sector.
And Dylan, this is Tracy. I just want to amplify that I think that this report, having been done in the way it was, and as comprehensive a look as it was across the country, and while it may have, initiated around what are we really understanding about the financial health of the sector, what it really ended up being is an understanding about not only where we stand today, but really where we can go and how we do that together. And so the part of the platform that I think Susan and I would like to ensure happens through the Alliance and through APHSA is what kind of conversations can we start that not only build stronger partnerships across community-based organizations and public agency, but also start to turn this perception in ways that are really impactful. And even in choice of words, and really building on the idea that we sit together on sectors that with and through families in our communities can achieve the kind of outcomes we're looking for. That starts to shape a different conversation that you have with the public, and we hope that you'll help us with that. This is where really all of you on the call, everyone who's worked in the sector for a long time, and even those of you who are new to it, can really be helpful in helping craft a collective narrative. It doesn't have to be exactly the same, but a collective narrative that starts to talk about the sector in a very different way.
This is Susan. I just want to give a shout out. I believe Lee Sherman, the head of the National Human Services Assembly, is on the call here today. And National Human Services Assembly has done a great job in bringing the framing science into human services. And it will be very important that we not just think about others' perception of us and how do we change it, because I think we first have to really have a deep exploration of how we are talking about ourselves, how we talk about ourselves as a sector, how we talk about the work that we do, how we talk about the people and communities that we serve. And if there's anything I think the framing science helped us to understand is that without intention, we can perpetuate that myth of us being seen as charities by ways in which we frame our organizations, the work we do, and the populations that we serve. It was one of the reasons why I think it's just important to remember that when Tracy and I went into this, it wasn't because there was going to be finger pointing in just one direction. The only way we're going to come together and truly solve something that, folks, we've been talking about for decades is if we understand we each have a role to play in both the causes and in the solutions. And changing this myth, I think, is going to be all about that happening going forward.
We have time for a few more questions. Clark Nordberg asks, these seem to be strategies for individual organizations. What are recommendations for policy and systems change?
So this is Tracy. I think one critical component of that is being able to leverage, this is where having two membership organizations in partnership with one another that are critical drivers in coordination also with some of the folks who were so generous in their funding, so the philanthropic community is part of this as well. If we think about going into this work and being able to lift up what's happening across the country, that's how we start to move the other policy levers, right? The policy levers, the fiscal levers, the system levers that are going to be part of, one, first changing the narrative so that we have productive conversations about what is the sector is doing in partnership with government and philanthropy, and then how we can really start to have conversations that perhaps shift things at state and national policy levels, and also the ways in which we might be able to design new ideas, right? So the one thing I mentioned, which is still being framed up, is a partnership with social finance and doing some procurement and contracting reform on the ground, but with the intentionality that we would be lifting up what we learn from that kind of demonstrations that might be done across the country to really drive the systems change we desire.
Thank you, Tracy. Are there any other questions? If not, I would like to thank all of you for joining us this afternoon. Just a reminder that the final report and toolkit can be found on allianceone.org, and we encourage you to share this with your colleagues and networks. And if there are any questions, you can email nationalimperative@allianceone.org. I want to thank you all very much for being on this call. I'd like to ask you to take ownership of the report.
Think about ways that you can disseminate it within your networks. Can you get it in front of a county board, a city council, a state legislature? We'll be working to get it in front of the federal government on many levels, but I ask each and every one of you to join us in leadership, own this report as your own, bring it to life, and help us to move these recommendations to action. So I just want to thank you all very much for being on the call today.